calcium. My name is Carrie McMillan. The roles of calcium in the body. It's the most abundant mineral in the body. About 99% of the body's calcium is stored in bone and teeth to help support their structure and carry out their functions. Less than 1% of the total body calcium is needed for vascular contraction and vascular dilation, muscle function, nerve transmission, intracellular signaling, and hormonal secretion. Body uses bone tissue as a reservoir and as a source of calcium to maintain constant concentration of calcium in blood, muscle, and intracellular fluids. RDA for children, adults, and pregnant women. For children, boys and girls, 1 through 3 is 700 milligrams per day. 4 to 8 years old, 1,000 milligrams per day. And 9 to 18 years old, 1,300 milligrams per day. For adults, for men 19 to 70 years old, it's 1,000 milligrams per day. 70 and older is 1,200 per day. For women 19 to 50 years old, 1,000 milligrams per day. 51 and older, it's 1,200 milligrams per day. Then we have pregnant women, 14 to 18 years old, it's 1,300 milligrams per day. And if you're 19 to 50 years old and you're pregnant, you have to consume 1,000 milligrams per day. Calcium deficiency. When you don't get enough calcium, you increase your risk of osteoporosis, which bone becomes weak and brittle, causing severe bone loss. Osteopenia, bone density is less than normal, but not as severe as osteoporosis. Then the name for calcium deficiency would be hypocalcemia, which is calcium level in blood are too low. Children may not grow their full potential height as an adult because they don't have enough calcium. Causes of hypocalcemia: poor calcium intake over long periods of time, especially in childhood. Medications may decrease calcium absorption. Dietary intolerance to food rich in calcium. Hormonal change, especially in women. Certain genetic factors, and lack of vitamin D. Calcium deficiency continued. The name for the deficiency is hypocalcemia, which is the calcium levels in blood are too low. Hypo meaning below, calcio meaning calcium, emia meaning blood condition. Normal levels are 4 to 6 milligrams per deciliter. Deficiency is below 4, and children and teens tend to have a higher level. Early signs and symptoms: dry and itchy skin, eczema, weak and brittle nails, poor dentition and cavities, easily fractured of bones. Severe signs and symptoms is hallucination, depression, numbness and tingling in hands, feet, and face, muscle cramps and spasms, confusion or memory loss. Calcium toxicity. Toxic levels is 10.4 milligrams per deciliter for calcium concentration, and then the ionized is 5.2 milligrams per deciliter or greater. Signs and symptoms is fatigue, defensiveness, pain, depression, muscle weakness, arthritis or spondylitis, kidney or gallstones, bone spurs, and slow metabolism. Supplements versus food sources. Researchers' conclusions about calcium intake published in May issue of the American Journal of Clinical Nutrition came from a study of 183 postmenopausal women. These women had the right to detailed had to write a detailed diet and supplement intake for a week. The first group is supplement group. They consumed 1,030 milligrams per day. Group 2, which is the diet group, consumed at least the least amount out of all three groups of an average of 830 milligrams per day. But they did have a higher bone density in spine and hip bones than the supplement group. Group 3, which is the supplements and diet group, consumed about 1,620 milligrams per day. They had the highest bone mineral density. Supplement calcium differ in how they can be absorbed. For instance, calcium carbonate tablets need to be taken with food so the stomach and acid can facilitate absorption. Calcium citrate tablets do not have this limitation. And only 35% of the calcium in most supplements end up being absorbed. For dietary calcium, it's associated with a shift in estrogen metabolism that favors production of active forms of estrogen, which contains active estrogenic compounds, and those can influence bone density and the amount of estrogenic metabolites in the urine. Dietary calcium is better absorbed than supplements, but still is not enough to fulfill your full calcium need in a day. New interesting facts. The name calcium is Latin. Calyx or calcis is Latin for lime. Calcium is extracted from limestone and also from marble and chalk. Out of all of the elements that make up Earth's crust, calcium is the 5th most abundant one. Diets high in animal protein and phosphorus-rich foods like soft drinks and cow's milk inhibit calcium intake. Animal protein and phosphorus is acidifying, and the body uses calcium to neutralize the acidic environment caused by consumption. Calcium used to neutralize the acid never makes it to the bone. You lose calcium when you sleep. Calcium loss occurs at a higher rate at night. Women lose more when they sleep than men do. It has to do with something. We have different sex parathyroids levels at night. The PTH monitors blood calcium levels, and men tend to increase their PTH at night, whereas women don't. It's better to take small doses of calcium. Our body can't absorb more than 500 milligrams at one time. And obviously, you need more than 500 milligrams a day. Calcium from vegetables is better absorbed than from cow's milk. Calcium from kale absorbs at a rate of 40.9%, and calcium from cow's milk absorbed at a rate of 32.1%. And then these are my references. If you have any questions, feel free to comment below. And this is my PowerPoint on calcium. Thank you for listening.